This is Red, White, and Bluegrass.
At odds between Republicans and Democrats over the government shutdown is health care. Republicans want the Senate to pass a short-term 7-week funding plan that passed the House last month. Democrats want an extension to health care tax credits that are due to expire at the end of the year. Republicans say they will not negotiate until the government reopens.
What we're trying to do to buy the extra time to get to November 21st is to give both chambers and this whole body 7 more weeks to figure that out. So it's not an easy solution. They know that very well. They know it as well as we do. But they're using that as a red herring because they want to drag this along so they can get political points.
If we don't act now, then at least 22 million people will see their health care premiums double on average. But for many people, it's even worse than that. If these ACA premium tax credits aren't extended, the average 55-year-old couple making $85,000 a year would see their premiums not just double, but triple.
Democrats argue that not extending the ACA tax credits will cause the entire health care market to rise. So, Mr. Yarmouth, I'm going to start with you here. Does that justify a no vote right now on this? How do Democrats reconcile with blaming the shutdown on Republicans whenever they are the ones that did vote no?
Well, first of all, what they're doing is being very deceitful about what they're doing. They did not pass a clean CR in the House of Representatives. They passed a CR that embodied all of the DOGE cuts that are very significant cuts. So it's a different bill. It's not continuing programs and current funding. The reason it's important to do it now is that in a matter of days, all of the notices of rate increases are going to go out. They're anticipating having to give rate increases based on the non-extension of the tax credits for the ACA. So as Leader Schumer said, people are going to see double and triple their premiums come up, going from $300 to $900 a month in some cases. Kentucky, we just saw the other day, Anthem said their rates are going to go up 37%. All of these things are related because as you take people out of the insurance pool, particularly if you take healthy people out of the insurance pool, everybody else's rates go up. So it's not just the ACA beneficiary or the users of the ACA and Kentucky Connect. It's not just Medicaid. It's everybody's health care is related and their insurance costs are related. So if we don't do it now, that's the first question, these rates are going to go up. Secondly, Republicans have shown that they cannot be trusted to negotiate. So if they say we're going to negotiate, what does that mean? They're the ones who refused to extend the tax credits in their big, wonderful bill. So why should we assume when they have the majority that they're going to make those changes now? They're not promising to do that. They're promising to talk about it. That's not good enough.
Representative Roberts, what do you think? Do you also see that sense of urgency?
I think that there's a red herring when we're talking about the ACA tax subsidies. For one, we need to look to the fact that Obamacare objectively caused health care premiums to go up throughout our time since its adoption and its rollout in 2014. Further, we need to look to what the alternatives were. What was the Democrat bill on funding the government? In exchange for 7 weeks of funding at the current levels that was codified and signed into law in July, they wanted an additional $1.5 trillion of spending. This included on page 57 of the Schumer bill, a bill to repeal the provisions of the One Big Beautiful Bill Act that closed the loophole that the Congressional Budget Office called that has allowed for 1.2 million illegal immigrants to receive federally funded health care. So I don't think that this is about the ACA tax credits, because if that's what it was about, we would keep the government open in order to have these negotiations, in order to have this conversation to get to where we are offering what the Trump agenda is, which is better services at a lower cost. And that's why we see the attempt to cut out waste, fraud, and abuse, to keep the services overwhelmingly the same for those who these services are actually meant for Americans in need. Medicaid was always meant for those who are drastically poor and cannot work for themselves, pregnant mothers, people on those lines, right? Those in nursing homes. It wasn't meant for those who aren't here lawfully in the first place, but that is exactly what the bill text does. I know the talking point is that that's not what they're trying to do, but bill text is king, and that's precisely what the language says.
No, he's wrong. The language doesn't say that. The language says that they want to extend things to people who are lawfully here. They may not necessarily be citizens, but they are lawfully here under one of the exemptions, either asylum or special treatment. there is no attempt by anyone to provide Medicaid eligibility for people who are here illegally. That's not what the text says. It never uses the word illegal. It says, talks about lawfully here. And so this is the Republican talking point. We're hearing it everywhere because it's the thing that generates most opposition. But it's not true. It's against the law for anyone who is illegally here to have any federal benefits.
Just a couple seconds left here. Could we, so it sounds like y'all both at least agree that y'all would want to see that this only covers legal citizens.
I believe that if you are here legally,
Not citizens, people who are here legally. That's the
So
the
citizens and
distinction.
non-citizens that are here legally.
Who are here legally.